see in this case, hello, it's one case in the interior region, and as you may see, we don't have enough bone to place the implant, because if we are working in the interior region, it is very important to be able to protect our implant with enough bone, because the bone will hold the soft tissue and this will give us a better aesthetic result. So this is the case, the clinical case at the beginning. Then when we open, you can see that the ridge is very thin. So we place our implants. These are blue diamond implant from Megagen. And then you can see that there is not much bone buccally to the implant. And we all know that if we want to have a long-term aesthetic result, we need to have enough bone to protect our implant, like 2 millimeter on the buccal, 2 millimeter on the palatal. This is why we decided to do a bone graft. We use S1 bone. I will show you in a while how we can use the S1 bone. It's a sticky bovine bone on the palatal part, on the buccal part. Then we need to cover all this with a membrane, because if we don't place a membrane, we might end up losing the bone. So we place a membrane, very important to put text to the membrane in order to be able to stabilize the graft. Then we need some PRF for better healing. We suture, very important to start suturing on 2 levels in order to cover the graft. And then we do a full suture and we let it heal for a while. And this is the situation after full healing of the bone. We open, we place our temporary teeth in order to guide the soft tissue healing and in order to keep the aesthetic for the patient. And you see the situation before and the situation after recreating the soft and hard tissue of the patient. So we were like this, and we gain more tissue and more bone, which will give us more stability when we are going to place our final restoration. This is the final restoration that were placed following the new architecture of the soft tissue that was created because of the bone. To place our final crowns, and you see the bone on the buccal of the implant, and this is very important to have this bone, because this bone will protect our future restoration. This is another case, a full mouth. So we need to check radiographically the situation in this case. And when we look at the radiograph, you see that we have very minimal bone at the sinus area. So we need to do sinus floor elevation, sinus graft. And then when we get to the area of the premolars, where we were going to place our implant also, you see that the bone is very thin. In this case, we decided to do a 2-stage procedure, which means that in the first stage, I'm going to do a bone grafting, and on the second stage, I will recreate the soft tissue and hard tissue envelope, and I will place my implant. As you can see, the bone is very minimal, and in the posterior area, we need to do a sinus floor elevation, and I will show you the sinus floor elevation in a while. And this is the 3D image of the patient maxilla. So you see, we are left with very minimal bone, and in this case, we need to do a major reconstruction of the bone. Now, if we want to use autogenous bone, we will need a lot of autogenous bone to do it. This is why, in this case, we decided to use bovine bone and membrane. And I will show you the bone that we did. In a few, we will do a hands-on. This is a very special sticky bone, bovine sticky bone. So this is the situation when I recline the flap. You see that the bone is very minimal. I open my sinus. Then I take the sticky bone that I place inside the sinus. So we do the sinus graft. And then we add some bone on the palatal, bone on the buccal, and you see that now I created a lot of bone. Always do more bone than you need because you might have a little bit of resorption afterward. We cover with a membrane, and it's very important, as I said, to do the suture. I'll show you now the video of the second surgery to see how you're supposed to do the suture in order to have full closure, because we don't want to have any exposure of the membrane and any infection of the membrane and the graft. So we will see the surgery from the second side. It's the same. I start by doing my incision. It is always very important to cut all the way until you reach the level of the bone, because we need to elevate a very neat flap. We don't need to have tears or perforations inside our flap. I elevate my flap. So you see how I will detach the periosteum. I need to have a nice view of all the bone because I'm going to do a sinus floor elevation in the posterior. So you see, this is the flap. I expose my bone on the buccal, and you can appreciate how thin is my ridge in this case. Once I expose my bone, I need to clean all the granulation tissue, soft tissue that are on the bone, because if I want to do the graft, I need to have a very clean bone where I will place my, my graft. And you can see here how thin is the bone. So we are looking at a case where we have 1 to 2 millimeter only of bone thickness, plus a pneumatized sinus, which means that we are going to do a sinus floor elevation. So with the piezo, I remove every debris, and this will open the vascular channels inside the bone in order to have a better vascularization, because this vascularization will help heal the graft that I will be placing later on. Then the second step now will be, once I remove, you see, I still have some granulation tissue. I have to open my sinus here. Remember, we had to do a sinus floor elevation. So I start with my sinus. I always use the technique of scraping the bone. So I will scrape the bone until I have a view of the sinus by transparency. And now that I am thinning my bone, as you can see, I remove all the part that is external to the bone. So instead of having a thick bone, I end up having a thinner bone at the sinus. And now I start cutting to open my window. Usually I do not want to retrieve my window, because the studies show that if you retrieve the window and you place it back, there is no benefits. You take more risk of having a perforation of the sinus. This is what we don't need to happen. So with my piezo surgery, you know that piezo surgery will not harm the soft tissue because it's a tool that was made specifically for this type of surgery. Now I start removing the bone and accessing my sinus. In this case, I have a thick bone. Sometimes the bone is thinner. When the bone is thick, it might be a little bit more timely to open the sinus, but you can see that it is a very quick and easy procedure if you are using the perfect tools. Now I just perfecting my window in order to have a good access to the sinus mucosa that you can see here. So this is my sinus mucosa. I still need to enlarge a little bit my window here on the mesial. Always very important on the mesial part to be able to reach the mesial floor of the sinus that is somewhere around here. So when I go inside, I don't want my carrot to lose the bone. I need to follow the bone. So I detach now the window around the sinus windows. I detach my mucosa. And now with this sinus curette, I start sliding over the bone in order to elevate my sinus membrane. So you see how I always keep the contact between my elevator, my sinus curette, and the bone in order to be able to elevate this sinus mucosa without having any perforation. Very important to avoid having perforations of the mucosa, because if you perforate the sinus mucosa, you might complicate your surgery, because then when you place the bone, this bone might migrate inside the sinus and it might lead to a sinusitis. This is something that you don't need to happen. So now my sinus mucosa is almost completely elevated, and you will see when the patient breathes, it starts going up and down, which means that we did a proper elevation of the mucosa. Now we need to protect it. This is why I place a PRF membrane inside. The PRF membrane will protect my sinus mucosa, and it will give me some release of growth factors inside the graft compartment, because we know that PRF have platelets, and platelets release autologous growth factor that can help our graft. And now we are going to close everything inside graft by using this S1 graft that I will show you later on. It's a sticky bone, bovine sticky bone, that is very nice to manipulate, because it can give you an easier way of placing. Now, because I'm going to place a membrane and the graft, I need to open inside the bone some small holes in order to bring more vascularization outside, and this will help the healing of my future graft. So you see how I do a lot of small opening. This will open the vascular channel inside the bone, and my site is ready for placing my graft now. So the first thing that I will do is placing the graft inside the sinus. Then I will place a collagen membrane and do my grafting, and I will fixate this graft with some pins in order to stabilize the graft. This is the membrane. So I place my collagen membrane. I start by fixing my collagen membrane on the palatal side with 2 pins. Always fixate the membrane. If you don't fixate the membrane, you will end up losing the bone. So you go deep and you place the first pin in order to fixate this collagen membrane. It's very important to have a stability of the graft, because this will ensure the proper healing. And now I start placing my S1 graft. This is the sticky bone. I start placing it inside the sinus. So this bone will go inside. It will fill in my sinus. Very important when you fill the sinus to fill all parts and go all the way until you reach the palatal part of the sinus. We should place as much bone as needed. Don't overgraft, but not undergraft. It should be enough bone. So you see, because it's a sticky bone, it is easy to manipulate and place inside the sinus, and you will have more stability of the graft. I pack my bone inside. Again, I place more bone. And once I've done filling my sinus, I will start by placing the graft over the site where I want to do the guided bone regeneration. And this is my last bone placement inside the sinus. So now my sinus is full of bone. I grafted all the way to the back, to the mesial, and to the palatal side. Now I need to start doing my guided bone regeneration. We need, when we build, to have more elasticity of the flap. So this is why now what I'm doing, I'm cutting into the periosteum of my flap to do a releasing incision inside the periosteum, because I need the flap to be more elastic. We do one cut, and then we start detaching from the inside the flap in order to have more flexibility of my flap. So you see now my flap is fully flexible. I will start placing the bone to do my graft. So this is the S1 bone, the sticky bone. If you're interested, we will do some hands-on. It's very easy to manipulate. So I start filling in the palatal side of my graft. I build from the inside. Then I build from the outside. In order to have a wider crest, this is what we need. We need to have a very wide crest when we will place our implants later on. So I add the bone, and once I've done enough bone, I need to cover this bone with the membrane, as you can see here. And very important, we need to stabilize the membrane. So I put pins on the upper part. I cannot put in the back because I have the sinus. And now I put always PRF above it. The PRF will help promote a better healing around this membrane and the bone. And now the challenge will be to be able to close over the new graft that we created. This is why it's very important to have a good, as I said, elasticity of the soft tissues. The first sutures that we do are sutures to close on the deep part of the flap, because we do on 2 steps. So we do U sutures to bring in the flap on the inside. This way we will protect our graft. And you will see now, once I do my 3 sutures, how my flap will be almost closed, because we did the proper release incision for the graft. Very important step. Otherwise, you will have an exposure and you will lose everything. So every step of the surgery is very important. So you see, I did 3 U sutures. I still need to fixate the corner of the flap here. And now, without even closing the flap, you will see that I have almost everything is closed. What I do now, I do interrupted suture, and this is the end product that I will have. I will have a full closure of my flap. Now we need to see the result of this graft. It is very important then to avoid having infection, avoid having any exposure of this flap. This is why it's very important to follow all the steps. Now, when we open again, you see how much bone we have. Remember, we started with less than 2 millimeter, 1 to 2 millimeter of bone. This was the situation before. This is the situation now. Now I have 10 millimeter of bone in width, and now I'm ready to place my implant. So I use my implant, and these are any ridge Megagen implant. They have a very good surface, very good geometry in order to give us a very nice osseointegration. We place 3 implants on the left, 3 implants on the right. And this is the situation after temporization. You see how we recreated the soft tissue. We placed multi-unit abutment, and look at the bone that I created around this implant, and this is very important. And if we look here, you see the bone that was recreated around each of the implants. Implant number 1. You see on the second implant, on the 4th implant, the 5th implant, and the 6th implant. So it's very important to be able to restore in order to end up with a situation where we can restore all the teeth and restore the case for this patient. Now, if you are in the extraction socket, this is where it gets more complicated. So I talked in the morning about it. I will show you one case because we don't have enough time before we can do a full mouth case. Okay, so this is the case of a patient. She needs to remove all of her teeth and place implant, and we need in these cases to do immediate loading. So it is very important to be able to plan this case digitally. And this is what we do. We do digital planning because we want to do guided surgery and we want to do immediate loading of this case, and we need to graft in order to keep the hard tissue and soft tissue envelope. So this is the planning that I did for my 6th implant. It's very important to planify everything before. Then we start by doing the extraction. It's also important to do the extraction without having any trauma to the bone, without having breakage of the buccal bone. We remove the teeth. Once I remove the teeth, I place my surgical guide, and I will fixate my surgical guide with some pins because I don't want my surgical guide to move. This is very important in order to have a perfect placement of my implant later on as planned. And then once the surgical guide is placed, fixated, I start drilling in order to place my implant. Now the drilling starts being very easy because you follow the guided surgery protocol based on the study that you already did. I will place 3 implants on the left, 3 implants on the right, all on 6. Whenever I can place 6 implants, I prefer to place 6 rather than 4. And it is very important in this case to use the proper implant because you need proper stability in order to be able to do immediate loading. Because without immediate loading, it will be difficult to restore the aesthetic of this patient. So now I placed all of my implants, and now is the last step before placing the temporary is recreating the bone envelope, and this is where we use this bone, this sticky bone, the S1 bone, that will fill into, you see, it takes the shape of the socket, and I just place it inside my socket. Very easy to use, very stable bone, you will see the results. I always graft the gap between the implants and the buccal bone. Very important also always to graft the gap using bovine bone because you need stability for the aesthetics in this case. And once all of these gaps has been filled with my bovine bone, with my sticky bovine bone, you see that now I fill everything. The last step will be to place my temporaries. So I put my temporary abutments and I put my temporary crown. This is the situation at the end of the temporaries. Healing, early healing, 6 months healing. See the situation, look at the bone. It's very important when you want to have good soft tissue is to have good bone, as we said. Always preserve the bone envelope in order to have a nice soft tissue. And look how much bone. This is the grafted bone that I have on the buccal. So with this S1 bone, I could recreate the buccal shelf of this patient as planned in the restoration. And this is the situation at 6 months. This is the situation at 1 year. And you see how much stability we have because we follow the proper protocol and because we use the proper bone in order to keep the hard tissue contour, because the hard tissue contour will give us the soft tissue contour. It's very important. They are always related. You cannot have nice soft tissue if you don't have nice hard tissue. And you see how much bone we have, and if you look at the bone buccal to the implant. It's very important 1 year later to see how much bone I have buccal to the implant because I followed the proper protocol and I used the proper bone that kept the situation as it was clinically and gave this patient who went from here to there to this final result. At 1 year, you see how stable is the bone.